course, because, as we heard, nurses do lift 1.8 tons per shift. What I'm going to share briefly with you is the high-risk activities that they actually do that incurs that damage. When they reposition a patient, we're talking about manual labor. That's lifting a patient up in bed. They're extending their spine, and they're causing what they call micro tears to their spine. When a person lifts a patient, just as the same thing as when a person smokes a cigarette, it's an analogy, they incur damage to their spine. It's been proven. Biometrics show it. Dr. William Morris out of Ohio State shows this. Repositioning patients, again, transferring patients on stationary tables causes 22% of the injuries, okay? Catching a falling patient causes 17% of injuries to safe patient handling injuries to our nurses. It is these repetitious tasks on a daily basis, the repetition of it, that causes the cumulative trauma for our nurses, okay? And all healthcare workers, orderlies, not just nurses, but we're here advocating, of course, the Massachusetts Nurses Association. So we've identified the problem, and also we've identified the solution. As Beth just spoke to, and as other people have clearly stated, it's a comprehensive program that's needed. It's not just isolated a piece of equipment here. We can spend thousands and hundreds of thousands of dollars, but if no one's there to own the program and to see that it's happening, managing the program is what we're talking about. The hospitals and facilities, healthcare facilities, need to be responsible for managing a comprehensive program. Throwing money at this is not going to do it. Having people own it and be responsible for it is what's going to make this work. So how did this bill happen? It came about by a safe patient handling task force, nurses, and other healthcare professionals who contributed, and we actually made the language for the bill, which requires hospitals to buy equipment, make appropriate training available, have procedures for workers who refuse to lift with unacceptable risks for patients and self, and importantly, an annual performance. What does this mean? A good business plan. What does this mean? Saving lives for quality of functioning, and also saving money to continue working as a hospital and to ensure jobs for our people. Thank you very much.